Let's talk about, people want to be able to wrap their head around these kind of things. What are some innovative examples of things that have been working or that you're experimenting with in connected TV and all the things we're kind of talking about today?
Sure. I think connected TV has kind of been a hot spot, I guess, for the last several years. There's been a lot of advancements, a lot of innovations. In my opinion, I think where we're really seeing a lot of movement is in the data connectedness that's powering the connected TV. So, when it first started, it was, you had to work with a data supplier or a tech supplier or an individual supplier, and it became actually more fragmented. And what I think some of the more innovative organizations are doing, and what we're trying and seeing a lot more often these days is a data strategy, a data connected strategy, an audience strategy, and something that pulls all of the different connected platforms across together so that you can truly deliver kind of that omni-channel, omni-message delivery at a specific audience.
And was that the sector getting simpler, or did you do something to make that pathway a little bit more clean?
I mean, at Publicis, we built the technology to do that, but also I think the sector and the sector matured, right? So the sector went from what's possible within the confines of a walled garden to what's possible as an industry, and I think the entirety of the sector has been really positive in terms of reacting on how to do it right, what's right for the audience, what's right for the advertiser, in a much more simplified way.
Mark, do you have without, again, you don't want to reveal any specifics that you should, but any examples of innovation in this space and how they really have driven measurable results?
Yeah. It's funny, starting with context, I think for a long time in this category, there were the linear TV investments and then the digital investments over here, never the twain shall meet. One of the things that we're seeing a lot of success with is when you purchase multiple media formats from the same DSP, for example. You purchase your advanced connected TV inventory, display, online video, and streaming audio. You actually have a lot of success with reach and frequency controls. So if you're successful in reaching your audience, you can actually kind of meter out the ads across different platforms and channels, and we are seeing a lot of success with that.
Would you all agree? Is the siloing thing getting better generally? I think it's going to depend on brand and category, I guess, but that has been an ongoing challenge. Katie, you're kind of nodding.
Yeah, I would definitely say from a TV perspective, historically we've seen the business very siloed, play around awareness. And today what we're seeing is precision targeting across all channels. With essentially the best way to do it is with one audience, and for many different reasons. One, from a risk perspective, I'm not going to get into privacy, but healthcare is a highly regulated space, and the more data or more partners that you introduce, the more risk you create for the brand. In addition, measurement is, one of these things that if you don't have a consistent partner across all channels, it becomes difficult to optimize your channel mix. And then, lastly, kind of reinforcing a message consistently from channel to channel is essentially, the gold standard.
Lindsay, you should jump in here. What about, this idea of trying to integrate not only just all of television, but other marketing channels? Are we making progress? What kind of innovation would you like to see there, perhaps?
Yeah, I mean, I think this is exactly what an independent DSP like the Trade Desk is built for, right? We have complete control across all digital channels that are activated within our platform, which allows our partners to really take an audience-first approach, but also make real-time adjustments in how they're spending in order to sort of, maximize their qualified reach, to drive cost efficiency and drive incrementality. I also think, we're a platform where you can layer on the right combination of data to make sure that you are getting that level of precision throughout your campaign across all of the channels that you're running. And then I think kind of the last piece of it is when I think about a true holistic marketing strategy, I think about being able to connect the dots between all of your online digital activations as well as your offline. And with an open DSP, data flows freely in and out, and our partners can ingest our data down to the impression level to help inform their offline tactics, which I think has become increasingly important, especially in pharma when you think about all the Salesforce activity that's happening outside.
Mark, that all sounds ideal. I imagine it's not always going to play out that perfectly. What's in your way? Like, what are some of the obstacles, either for just taking advantage of advanced TV more or doing that kind of integration that we're hoping for?
Oh, no, Mike, it always plays out that way. Exactly as Lindsay mentioned.
Right.
No, I'm kidding. I think one of the biggest challenges with pharma adopting some of these strategies is that if you're trying to build awareness for products in this category, linear TV works. That's one of the things we've said. Innovation is usually forced. So if you know that you can, spend money to drive awareness for a brand, why change, right? So I think the arguments or some of the things that we bring to our brand marketers that are trying to drive awareness is, can you drive the same awareness for less money, or can you drive increased awareness for the same amount of investment? And then we have to introduce these channels. We've had a couple of brands actually now at this point reallocate, some of their investment from linear to advanced TV, and they are seeing leading indicators improve. They are seeing branded search volume go up, even at lower levels of investment. So I think one of the biggest challenges is just kind of getting that efficiency message there to the brands that are making those investments.
Lindsay, I want to ask you this, but anybody can kind of jump in. Erica kind of talked about how, again, this category it's going to be unique depending on the brand and the target. Optimization isn't easy, or all the things we like to do to try and refine media spending over time. How can that be improved, but beyond the inherent lag of data that sometimes is part of this category?
Yeah, I think there's a couple things, right? I talked a little bit about being able to layer on the right combination of first-party and third-party data to drive incremental reach, and I think that in combination with leveraging in-platform measurement solutions, like in the pharma category, we have one with IQVIA and Crossix, right? But allowing you to do those real-time optimizations to the KPIs that matter to you, and again, in pharma, it's typically audience quality is that kind of first leading indicator that you're able to get very quickly and optimize against, and that has a high correlation with
So you don't have to
script lift.
wait for those prescriptions to get rid necessarily.
You don't necessarily have to wait for the script lift, right? There are sort of more quick to market metrics that you're able to use, audience quality, cost per in-target reach, that will have a correlation with what you will ultimately see when your script lift readout comes. I think the beauty of a DSP is that it's agile, right? And that you're able to make these real-time in-flight changes to really drive your performance and make sure every impression counts.
So I think I'll just add to that. I think it's really important, and Erica said it in the last panel, but there's so much more than the final script lift metric. And one thing that we're really big on is looking at performance throughout the funnel. So not everybody is even, months, weeks, or even potentially years from actually getting on a therapy, but there's so many other things that we as marketers are looking to do, whether that's to drive brand advocacy or to build awareness of a condition or to build awareness that there are treatment options when you're launching a new condition. So the metrics the way she put it is lead versus lag metrics, which I think is right, but the metrics that you're looking through across the funnel are equally, if not more important than looking at whether you're driving the conversion, because the conversion will come and it's a consultative process between patient and provider and probably a number of other stakeholders, but the role of marketing is far more than driving scripts. It's education, it's comfort, it's confidence, it's conversation. So are we driving people to join patient communities? Are we driving people to seek treatment options? Are we is it influencing human behavior at all, and in what way? And that's also how we make wiser business decisions moving forward. It's to how we plan other channels and how they work in concert. But it's a miss at the industry level to do a readout of whether or not this investment just drove an ROI in the form of script lift. But it's really much more indicative of true performance when you're looking at human behavior, actions that we've influenced over time and throughout and across the marketing funnel.
Just from a data lens, when we look at what you would consider optimization, it's really ensuring that the data is as fresh and quality as it can be, right? So we have clients that say are in the oncology business, and it's really incredibly important that we're able to reach those patients and their associated providers during a very small window from diagnosis to treatment. And Erica mentioned the 30-day lag in claims data in some cases. So it's really incredibly important that your agency, your partners stay on top of that to ensure you have the freshest, newest data. So you're not just getting high audience quality on patients that are no longer, going to be consuming your products. So.
And is that true both for understanding the audience and their behaviors as well as the targeting you need to do?
Yeah, I think from understanding a behavior perspective, we're in a really interesting space today because there's an influx of data available to all of us. It comes from everywhere. And the most challenging thing for marketers today in every vertical is getting the data so that it's digestible and actionable. And essentially, you can do that today with AI, right? So when we talk about understanding our patients, we think about, let's understand the patients that we're out targeting today. What types of messages are relevant to them? What resonates from a copy perspective? Does this image of, a female 30 years old resonate with this group or not? And you can get pretty accurate, information back based on multitude of data assets. And yeah.
All right, so you started the AI conversation. We had to go there eventually anyway. Lindsay, what about, in this category, I could see a wealth of possibilities, but also like a little bit of a caution. I'll kind of maybe ask everybody this, but how do you think it's going to help advance things, and where do we have to maybe be careful?
Yeah, a little bit of a loaded gun on the last part of that. But no, I think really no matter what category you work in, right, with marketing, we're all trying to drive consumers to take a very specific action, right? In the case of pharma, it's trying to get them on script. At the trade desk, we use AI to analyze millions of signals in milliseconds to be able to determine what impressions are most likely to drive that outcome, right? And then it's not just about who you're targeting, but it's about where you're targeting, what message are you targeting them with, and at what cost are you targeting them, right? And that's just something that a human can't do, right? Our entire platform is built on the foundation of AI in terms of helping make sure that our clients are getting the most value out of every impression through our platform. In terms of where you have to be careful, I think with pharma, there's a lot, right? There's a lot of privacy considerations, and we at the trade desk take a pretty conservative approach in terms of how we think about it, and but I think it's evolving every single day in terms of where it could go. It's really hard to predict at this point.
Marc, how do you, knowing that everything is changing so fast, how do you think this plays out over time? I wonder if brands are going to have their own AI models for media buying and optimization purposes. Are they going to rely on big partners? Are the agencies going to kind of play a central role there? All the above? What do you think is going to happen?
Yeah, I won't try to predict how AI is going to evolve in the next couple of years based on how it has evolved in the last 2 or 3. But where I see it playing a role today is obviously we spend a lot of time and energy trying to determine, who is the patient or who is the healthcare provider. In an anonymized, compliant way, there are brands that are focused very much on that and crafting an audience based around that question. Where I see AI helping, even today, is as a supplement to that. So if you are treating, an acute rare disease, you're only talking about a population of maybe a couple thousand people. But what AI is telling us is there are more people who would care about that message or that product. I mean, if you think about, some of us have aging parents, 60s, 70s, 80s. Are they the ones that are going to see a product that could potentially help them? Or is it going to be their kids? And when you're crafting an audience of people to target, and all of your insights tell you this is the person you need to go after, what AI is now doing is say, hey, expand beyond that. We have a high probability or a likelihood that this person is going to convert on this ad. And what that means to us is, who else beyond the people that we are explicitly targeting would care about this message? So that's where I see AI playing a role today, and I hope that sharpens and improves into the future too.
Andrea, you guys have invested a lot in this realm. I think people wonder whether this is ultimately going to be only a capability of the biggest tech providers, and that means brands won't always know what's going on, which is not great for a lot of categories, but particularly this one. Talk about what you're doing there and how you maybe see that battle playing out, if it's a battle.
Yeah, I don't know that it's a battle. I think it's a partnership, to be perfectly frank. I absolutely have some clients who are trying to build a lot of the AI capabilities in health. As you mentioned, we've invested a lot at Publicis in our AI solution set and all of the things that we can do with it. I think, and we've made some really great progress in a really short amount of time. I think some of the early use cases, to Marc's point, is, what it can do now, what it does now, what we use it for today is smarter, faster targeting, more sensitive approaches to how we ingest and utilize data in an actionable, meaningful way, and how that translates to activation, does that today. And that's true, I think, not just at Publicis, but in like the industry. That's kind of a current use case. I think future state use case, and where we aren't today, and I think where we'd all like to be, and where some of the guardrails and the barriers come into play in this industry is, what's possible is that you could start to version your creative so that you had actually more messaging to deliver at all of those points of the funnel that we were talking about. We could say more interesting things that were more responsive to somebody's data signals that they were putting out there. But the current industry is not really built for that, because just because the technology could do it, it still is going to have to go through med-legal review at the manufacturer side. We're still going to have to get a lot of version control. We're still going to have to go through the regulatory process of getting assets, ready and approved. So, like, the promise and the possibility with AI won't be fully realized if the industry doesn't change and evolve around it. It can do it. It's just we're not going to be able to execute it in that way as we'd like to. And I think that's where we are today. So if you ask me this question a year from now, I'm hopeful that we would be, finding ways to go faster in those spaces, because the technology will outpace the capability, the readiness.
Do you think, Katie, or anybody, do you think in a year, the industry will just have, developed those muscles or gotten the lawyers used to what to ask and we can move really fast? Or is it always going to be a little bit of a conservatism around this, given that brands want to control their messaging and they're just risk averse?
I think we're going to see it. I mean, I'll let Marc speak to it, but I'm seeing interest and receptivity from brands and major and manufacturers on the manufacturer side. They get it. They get that that's the possibility, and it's retraining an institutional values and knowledge base within all of the different teams that are they understand and are open to it. It's just getting there.
So the thing that excites me about this is, as technology evolves and develops and legislation is updated to reflect that, our legal partners and compliance and regulatory partners want to learn more about how media works, how targeting works.
Not just defaults, like no.
Not at all. At least not for us at Genentech. They do have an interest and a curiosity to understand it at a deeper level, which kind of erodes some of that protective nature or risk aversion that you often see in the category. And I think that's the only way forward for us, and I won't speak for any others in the category, but you need to have those folks that are helping you stay compliant, understand technology, in order to give you the best guidance possible.
I think there's going to be some flavors too. I think it's, there are going to be some leaders in the pharma space that are really driving it forward, and to your point, have the internal infrastructure that really wants to learn and progress. And I think there's going to be some that are a lot more cautious and take a lot longer to get there, right? I think it's going to be a journey for every different manufacturer, and will take some time to get there.
All right, Katie, you have the last word here. Where in a year are we in a place where where you're using all these different creative variations and it's so much smoother, or does it take a lot of time?
Yes, and you have to take it a step further then, right? Because we talk a lot today about targetability, but when you start looking at things like the modern day website, it's had very little in sophistication. And so, I think that's where you'll see, in the next 5 years, some really big fast forward changes around engagement of, patient and providers on the site, engaging in a human-like experience, which is also collecting data back and really fueling your overall marketing decisions. So closed loop from, planning to targeting to engagement and then fueling your overall decisions.
All right, that's a hopeful note to end on. Thanks, everyone, for a terrific discussion. Have a great rest of your day, everybody.